Hey there, it's Luke from Genuine Physio, and in today's video I'm just going to take you through 2 exercises. That's it for your sciatica. Now these are specifically for nerve pain. Make sure you keep watching until the very end, as I will tell you when you should be implementing them during your sciatica recovery and exactly how to progress them over time. Very briefly, before we jump into the exercises, I'm a very firm believer that you should understand why you're doing what you're doing, because otherwise, where is the motivation to do it? You're just doing some random exercises from some random guy you found on the internet. So what we're doing with these 2 exercises is trying to mobilize the nerve. So if you have a sore, irritated, slightly swollen, inflamed nerve, the idea of these exercises is that you put the nerve under some tension, and the theory is that that might help to improve blood flow to the nerve, which can facilitate recovery. It can help to reduce edema, so swelling within the nerve, which can also help aid recovery. And you're also engaging your nervous system to try and desensitize the nerve, so try and calm down the nerve and make it less sensitive to movement. So for the first exercise, you will need to grab a chair, you're going to sit down, and I'm going to talk you through what you need to do. So I am going to put my hands behind my back and I'm going to look down to the floor. Now, it's really important that when you're doing this exercise, you're really paying attention to what point it is and what movements that you need to go through in order to bring on some tension or tightness in the nerve, because that is the point you're going to stop. If you find that point and you keep adding extra movements on, you could flare things up. So you're going to start off with your hands behind your back and you're going to look down. Now, if symptoms are quite irritable, that might be enough to bring on some back pain and or leg symptoms. If that is the case, then you aren't going to go any further than that. You're just going to put your head on your chest and then look up. Put your head on your chest and then look up. For most people, you will need to do more movement in order to bring on symptoms. So the combined movements you will add in will be the chin on chest, and then you will extend the affected leg. So you can extend the knee of the affected leg. So for me, it's the left. And again, that might be enough to bring on symptoms traveling down the leg. If it is enough, then you just take some slack off the nerve by bending your knee, and then you're going to straighten it again and then bend it again. If your nerve is less sensitive and you need more movement to bring symptoms on, then you will add in dorsiflexion, so flexion of the ankle. So you straighten the knee, chin on chest, bring your toes towards you, and that will bring on a normal muscular stretch that anybody would experience. But if it brings on a little bit of symptoms, then the idea is that you point your toes away to take it off and look up to the sky. And then at the same time, after a second or two, you're going to put your chin back on your chest and bring your toes towards you. Now what this does is puts tension on the nerve and then slackens that tension off, puts tension on the nerve and then slackens the tension off. So I'm just going to show you again. So you go chin on the chest, toes towards you, toes away, look up to the sky. Chin on chest, toes towards you, toes away, look up to the sky. Now the second nerve mobilization exercise that you can do is going to be lying on your back. You can do it on the floor if you're comfortable, but you could also do this on your bed and set yourself up in a way that you could add some movement. So I'm going to show you a couple of different ways. Let's do the right side this time. So basically we're working on the same principle in that if we get some tension on the nerve by putting our head forwards and lifting our leg up, that's going to increase the tension, and then if we ease off the foot and ease off the head, that will ease off the tension. The way that we need to increase the range with this exercise is by working out how much bend in the hip we need which will be our kind of objective marker as to what point our symptoms come on. So we're going to start off and assume that our symptoms are quite irritable and that we don't need much hip bend. So you're just going to rest your leg on a couple of cushions or pillows, and that might be enough bend in the hip in order to bring on symptoms. And you are going to put your chin on your chest, bring your toes towards you, and if that brings on symptoms at that point, then you would just put your head down, point your toes away, and then do the same thing again. And what I didn't mention with the other exercise is that for some people, quite quickly, you will notice that symptoms dissipate and you have to take your leg through more movement in order to bring on symptoms. And that's a really clear, objective sign that your nerve is becoming less sensitive. It's becoming less sensitive, and you know that because you have to put it under more stretch in order for it to let you know that it's still a bit irritated. If this wasn't enough and you needed to get yourself into more hip bend, then you could just use a chair. So for most people, you're going to need probably a bit more bend in the hip than just a couple of pillows. You'd put your leg on the chair, lie down. That's going to pop a little bit of stretch on the nerve, and then you're going to bring your toes towards you, look forwards, point your toes away, head down. Toes towards you, chin on chest, head down, toes away. And again, if you've done a few repetitions of that, things would start to ease off. You just basically need to get your hip more and more flexed. However, you manage to work that out at home. So just the more you bend your hip, the more tension that nerve is going to be under. Now, I did say if you stay tuned until the end of the video, I would talk you through exactly when you want to start these and how you can progress them. Now, nerves are very sensitive tissues. This is not a strength exercise whereby you can hammer your legs and the worst thing that's going to happen is they might be a bit sore tomorrow. You need to take things gradually, okay? So this is something that you want to introduce and implement when your symptoms are happy to do so. Both of these exercises are also used as tests, physical tests in an examination that we would complete to see if you have sciatica, to work out how sensitive that nerve is to movement. So when you implement them, you need to implement them very gradually, very slowly, and you need to monitor how your symptoms feel at the time and how your symptoms feel afterwards. So my recommendation would be to err on the side of caution initially, maybe try 5, see how it feels at the time, see how it feels the next day, and then if there's no change to your baseline symptoms, so appreciate that if you're doing them, then you probably have some symptoms already. So if there's no change to your baseline symptoms, then it's at this point I would think about increasing. So it might be that you do 5 a couple of times a day. You then do the same thing, monitor how they feel at the time, monitor how they feel afterwards, and then you could increase that to 6 or 7. I would work my way up until I could do 10 a couple of times a day, and then I would probably do a maximum of 3 times a day and up to 15 repetitions of each exercise. But that progression that I've encapsulated in a few seconds could well take quite a number of weeks. What you don't want to do is introduce them when your symptoms are already irritable and then flare your symptoms up, because that is quite possible. If you are quite sore and you do 10 3 times a day straight away, then you're at risk of flaring things up. You're not going to want to do them again. So build things up gradually, build things up slowly, and just take a common sense, sensible approach to introducing them to your exercise routine. I really hope you found that video helpful. If you did and you want even more free help, then there is a completely free back pain guidebook in the description below the video. If you're struggling with nerve pain and you would like some more bespoke, personalized help or advice, then I do offer a limited amount of private consultations, both online and face-to-face. You can find info about that in the description below as well. And if you did find it helpful, please do consider liking and subscribing to the channel. It means more people will see the content that you have found helpful today. And whilst you're doing that, I'll see you in the next one.